Good evening and welcome to Door County Medical Center Live. I'm Dr. Jim Heise, Chief Medical Officer here at Door County Medical Center, and I'm joined once again by Sue Powers, Nurse Manager and Public Health Manager. See, I always get that wrong, no matter what I do. So that's the comic relief, is that I can screw up your title. Public Health Manager, say it, what is it?
Public Health Manager and Health Officer.
Health Officer, the officer part was what I couldn't get. So thank you all so much for joining us. Obviously, we're starting to experience now vaccinations, and so the light at the end of the tunnel is becoming more visible and brighter, and there's really been, when we've had some vaccination opportunities here for our Group 1A folks, there's been kind of a celebratory kind of an air, and it's been kind of neat. So it's really quite an achievement from a science perspective that we've gone from a brand new novel virus discovered in January or December of 2019, and they were able to sequence that genome in January of 2020, and here we are a year later and we're giving the vaccine. That's unprecedented and unheard of. So really, it's an exciting time. So our hope tonight is to, give you some information as far as what public health is doing, what DCMC is doing, and also to answer whatever questions you may have. Now, you have to understand, I think it's, before I turn it over to Sue, I think one of the big things that Sue and I have both experienced is, if it seems that when we're talking as though we're hedging or things like that, that has only to do with the fact that this is the first time we've really had to do mass vaccinations for a brand new virus in the context of a pandemic in our lifetimes. So there's a lot of logistics behind this that, thank God we have teams that are working through this, because there's so many things that you don't think of. So we're going to do our best, and my goal, as has always been on these Facebook Lives, is to be as transparent as possible, give you the information as we know it, and we'll kind of see where this takes us. So this will be about 45 minutes long. But why don't we start, Sue? Why don't you give us, from the public health perspective, give us your update.
Thank you, Jim. And I just want to say, I certainly agree with what he just said about there seem to be more questions than answers that we have, but I will do my best to answer questions. And if I'm hedging, I don't mean to hedge.
No, not
it
at all.
seems that way. And I'm just going to start out by saying that we had 30 more confirmed positive cases today. I mean, COVID disease is continuing at a high level in our county. Cumulative count is 2,243 confirmed cases in Door County residents. We've had 16 deaths and 76 hospitalized cumulatively since the beginning of this. Right now we have 303 active cases of COVID in Door County. And it is very positive and very exciting. We've begun to vaccinate Tier 1A, and probably everybody has heard of that. It's the healthcare workers and long-term care facility residents, so nursing home residents, assisted livings, and those folks. And we are very much at Public Health in collaboration with Door County Medical Center, as well as our partners in EMS and volunteers from, how do I want to say this? It's Chris Hecht and his people. And I'm sure there's a better name for the organization, but he's the ringleader, and there's some really devoted volunteers that certainly helped us in the last 2 days during our first drive-through vaccination clinics for the Tier 1A, which went very well. So I want to go through kind of how this works from the public health perspective, our ordering process and all of that. And I know it seems maybe where you're sitting that this is really a slow process. From us, it has come really fast. And to put it in context, Door County Medical Center, as well as us, are dealing with the COVID disease, and we're dealing with case follow-up and contact tracing, and everybody is on board with that, and we've hired limited term employees to do contact tracing, and we are full speed ahead every day. And then now we've gotten the vaccine component added on. And at Public Health, we've been doing vaccines for a very long time. This is really our niche. Although it feels burdensome at this time. It felt really nice to be in that niche again, because it's sort of like old home for me and some of the other nurses. So it begins with enrolling in the vaccine provider, and that took us several weeks. And by design, hospitals and clinics were allowed to enroll first. So Door County Medical Center completed that process ahead of us and were able to get their vaccine and get their important frontline healthcare workers vaccinated. And we are very pleased with that. Then they started processing the local health department enrollment applications, and we got approved. After you get approved, you get some more information and you have to fill out a survey. And then how many 1A tier people can you vaccinate next week is the question. So we had to try to get our best estimate, and we're sharing the responsibility for that community group with Door County Medical Center. We had many conversations about which agencies are you going to contact, which should we contact. We came up with a number, we ordered vaccine, and then you get it the next week. We got the Pfizer vaccine, which makes it a little more pressing, because from when it leaves the hub, which is at a secure place in Green Bay, undisclosed location, I don't know where it is, it's stored in ultra cold, and once it leaves there, it can be refrigerated for up to 120 hours, but it's got to be used within that 120 hours. So we just have this week to get that vaccine out. And we accomplished that today. I'm very pleased with that. The worst thing that can happen is that we waste vaccine. Yeah. We had very few people that had any sort of adverse reaction. I was able to get my vaccine today, and my arm right now is just a little sore. Mm-hmm. Kind of feels like I got a flu shot. We didn't have any major reactions. One person, I think we watched for an hour instead of the 15 minutes. So when you get your vaccine, there's a consent and the information is given, and you get a card that says you're vaccinated and the date and when you should come back, either 3 or 4 weeks later, depending on the dose. You get your vaccine. You're given information about the V-Safe program, which is a program that the CDC is asking everyone vaccinated to enroll in on their smartphone, and we get texts asking how you feel. I think it's daily for a period of time.
Yeah.
Obviously, I have not enrolled yet. I need to do that before tomorrow. Mm-hmm. And then after your vaccination, you need to remain at the site for 15 minutes for observation, and that's just for safety reasons. Part of it has to do with that this is a brand new vaccine. Part of it has to do with that is good practice for any vaccination, although it's not as important with this, except for this very new vaccine. So our estimated number of vaccines given for the Tier 1A was 1,450 doses. And as I said, second doses are given in 3 to 4 weeks. So who's eligible next in the next phase? That is a good question that isn't completely answered. I'm going to back up and talk about the long-term care facility residents. Mm-hmm. Kind of skipped over that. So nursing homes and assisted livings by design are not probably going to be vaccinated by public health. They have a pharmacy partnership program that the state rolled out, and the skilled nursing facilities, so that's the nursing homes, are pretty much all on board and up and running with that, have gotten first doses to all their residents and staff. The assisted livings that I've talked to are being set up, and I don't think they've gotten any vaccinations yet, but they've partnered and signed contracts and that kind of thing with the pharmacy partners. And in our area, it's Walgreens and CVS that go in and do the vaccinating. So they're being taken care of. We have been concerned with the adult family homes, and we vaccinated some of those folks. I hope we got them, but if you are an adult family home, please contact us if you have not received vaccine from us yet.
Okay.
I just ran out of steam.
All right. No,
I'll let you go ahead.
Sounds good. So there's been some really good questions that have come in already. I just want to throw a few things out there just to kind of reiterate some of what Sue has said. because a lot of questions that we get are, one is people will say, well, because they're thinking you're thinking from a perspective of like a flu shot. Can I just call my doctor and get a vaccine? So the most important thing to recognize is that when we talk about these priority groups, these are priority groups that are defined by the CDC, and how they are eventually parsed out it becomes the responsibility of the state, the individual state within which you live. And so right now we're 1A, which in our state, and I think in pretty much all states, is healthcare facilities and long-term care residents, so nursing home residents, and the employees. Those are the two main things. And so at this point, beyond those two, there is no ability in the state of Wisconsin to vaccinate outside of that. There's just not. So that's what we're waiting for phase 1B and phase 1C, and then phase 2, which will be sort of the broad vaccination. Just for informational purposes, from a Door County Medical Center perspective, we've had about 70% thus far of our employees have become vaccinated. We have about 725 employees or so, and so 70% of all of us have gotten vaccinated. Some are still, I know I just saw a colleague of mine who got the vaccine tonight. So it's not a matter of 30% have chosen not to. There will likely be some that won't choose to, but that's kind of where we are. We have also been involved, as Sue mentioned. We vaccinated quite a number of the emergency medical folks, the paramedics and things like that. So we were able to do that. So the other thing that I know I've seen a little bit, on social media, it's always amazing how much you see different information that people put out like it's real, and as someone that lives this, it's just, I can tell you it's just not true. The idea that either public health or Door County are hoarding vaccines. Why are you holding on to vaccines? As Sue mentioned with Pfizer, it gets shipped from the hub because Pfizer has to be stored at minus 80 degrees Celsius. Now that's pretty cold. If you don't know Celsius, it's exceedingly cold. That's the temperature that you would be dead in if you were sitting in it. So as you mentioned, what is it, 120 hours or something?
Right. So when we got the vaccine, it was 119 hours.
Yeah, you've got 119 hours to give that vaccine. So there is no such thing as, you get to hoard it. It doesn't happen, at least in the rural area. And as far as we're concerned, same thing. There is a shelf life to this. And the state asks you weekly for how many people can you vaccinate over the course of this week in that given category, and that's what we get. So the concept that we're hoarding it is silly, and for anyone that would put that forth, they just don't know what they're talking about. So that's kind of the situation there.
I'm going to add something.
Yeah.
The state pointedly asks us to how many people in the appropriate category we can do in the next week. And if we would hoard vaccine, or if we would misuse that vaccine, say just give it to anybody we wanted to, we would risk losing our vaccination privileges. In other words, we could risk getting future shipments of COVID vaccine.
Right.
And for me personally, I was the one that filled out the form for public health and signed my life away. And then after I completed the form and signed my name and said we would adhere to the rules, I also got a phone call from the vaccine coordinator at the state. And I had to say, absolutely, I will follow the rules. And it was a very serious conversation.
Yeah.
Yeah,
and I know a lot of people right now are there's been a lot of chatter in the news and things like that about people saying, hey, come on, can we move forward? It feels like Wisconsin is slower than others. And depending on who you talk to, it feels slow to me. People that I trust down in Milwaukee are saying, no, this is, we are about where we probably should be. I know other states, I think I heard Indiana is doing it just by age bracket. So states are able to they can do what they want as far as the priority groups. But we, living within the state of Wisconsin, have to follow those rules. So that's kind of where we are. So would we like to be moving on? Yeah. And we're hopeful that tomorrow I believe there's going to be a press conference from the governor. And we don't know this for a fact, but I think it's talking about moving on to 1B. So that's kind of our goal.
And excuse me. And we're already planning for that, right, Jim?
Absolutely.
We have in mind, what we think it's probably going to be is school staff, childcare, congregate living people that qualify for the IRIS program and family care, and then age 70 plus, a few other miscellaneous categories. And so we're talking about that, especially the schools.
The schools are big,
Yeah.
and also the age 70 plus
Yes.
that's going to encompass a lot of people. We know that in Door County proper, in our area, there are almost 8,000 people that are in this Phase 1B group as we expect it to be announced. So, and we're going to be continuing to update that. Public Health will be putting things out, press releases, things like that. We at Door County Medical Center, if you go to dcmedical.org, each week on the lower right-hand corner, you'll see a little vaccine corner. That's a video of me basically saying once a week, we're in Phase 1B right now. That means if you're greater than 70 or whatever, you can come in and get vaccinated. That's an example. That's not real just yet. So every week that's going to be updated. And so we're looking for any and all ways we can to communicate this information to the community. So I know I keep saying, and I'm kind of passionate about this, we're going to shout this from the rooftops. And whatever form that takes, we're going to do our best to get the information out.
We're also putting out information on our website, updating it daily. We're, as of today, started doing a weekly update that is going to be authored by my boss, the Director of Health and Human Services, Joe Krebsbach. And thanks, Joe, for taking that off my plate. I really appreciate it, because we want to give timely updates.
Yeah. We also will have, Door County Medical Center will have a phone number that you're able to call. It'll be a recorded message that, again, goes through and tells you specifically what phase we're in, and it also allows you to press 1 for more information. And unfortunately, I was going to write it down and I didn't. I have that phone number. I'll try, and if I can get through it over the course of this, we'll get that number by the end of the Facebook Live. Let's launch into some questions so we don't get too far behind. And some of these I'm just going to rifle through, and then you can jump in. Let's see. Here's a good example. Larry asks a very specific question about what tier is a 45-year-old man with Down syndrome going to fall into. It's hard to say. It may be 1C, maybe 1B. I'm not sure. I'm thinking 1C. Wouldn't you think? It's like we don't know. I mean, it's a complete guess at this point.
Yeah,
But
right now it doesn't sound like he would fit in 1B.
Yeah.
So,
Yeah. So probably 1C.
but that is a guess.
It's just a guess. I mean, based on what we've seen, they put forth an initial framework. And you can, if you have access to the internet, you can go on to Department of Health Services, DHS website, state of Wisconsin, and you'll find a lot of this information.
Oh, I was going to mention on the Wisconsin Department of Health Services website, they have a COVID vaccination page now. And I didn't look at it today, but as of yesterday, it's had state data on how many doses have been dispensed.
Yeah.
Beginning, I believe it's next week, it's going to be more granular, and it's going to be by county and region. So that'll be really nice.
That will be nice. Let's see. Tammy asked, what happens after? Are there symptoms like the flu? Sometimes you get a sore arm. That's a really good question. As we mentioned, sore arm. I had a sore arm, for about 3 days. What we're hearing is, well, first of all, we had nobody in the however many 800-900 that we've given from the Door County Medical Center side. No one has had a severe adverse reaction, not one. We have had a few where someone maybe they've had some chest tightness and they were monitored a little longer, things like that. What we're hearing is typically people, especially with the second dose, may feel a little feverish, they may have some body aches, things like that, and that's not a side effect of the vaccine. That actually is your body producing an immune response. So that's actually the reason that whenever we get the stomach flu or any kind of a bug, a virus, that's why we feel crummy. It's not the virus making us feel crummy. The virus is in there trying to do its worst to replicate itself. But the body is busy fighting it off, and it sends around these inflammatory mediators, these cytokines and different things to try and get rid of the virus, and that's what makes us feel crappy. So it's not a side effect of the vaccine at all. It's just actually what happens when you get it. So we did have, I know someone that actually had kind of body aches and a little bit low-grade fever after the first vaccination, and they had COVID. So maybe there's a connection there, who knows? But after 24 hours, they were good to go. So thus far, I'm vigorously unconcerned about that sort of thing. Let's see, Armassor, assisted living, like CBRFs, or community-based residential facilities. Do we know much about that?
They should be in a pharmacy partnership program. And if they are not, the state will assign them one, and I'm not sure who communicates that exactly.
Yeah.
But that is being rolled out.
Yeah. So that will be happening. I mean, I think they're high on the list.
I've spoken to two assisted living facilities in town, and they were involved in the enrollment process. Right.
Aaron asks, I'm concerned for families of essential workers. My husband will be eligible for 1B, but likely the earliest that Aaron will qualify is for 1C. So he could still bring it home to me, especially at our school district allows students back. Is there any way to be included as my exposure risk would basically remain the same? It's a really good question, and I'm in the same boat. My wife, who is watching right now too, is in the same boat. I've gotten the vaccine, she has not. So it's I guess I don't have other than, you're at the same risk you would have been whether or not he was vaccinated or not, is I guess the bottom line. That might be my way of saying it. I would love for my wife to be able to get it, but she's going to be in 1C. And so that's probably just the way it has to be, and that's the way it is. One thing I do want to mention, because I know it's brought up a lot, and this might be a good time to bring it up, is people have asked me, oh good, so when I get the vaccination, I can take off my mask and don't have to worry about wearing a mask. And that's actually not true. And I'd love it if it were true, but it's not. So we really are going to very likely wear masks or be needing to wear masks through the summer, is my guess. I don't know, Sue, if you have a different timeline, but at least that long.
I would be guessing, but
yeah,
but again, that sounds reasonable.
Yeah, and the reason is this, is the vaccine prevents against disease. It does not prevent against infection. And you say, well, what does that really mean? Well, think about the disease as that part of it that makes you sick. So you're down and out, you feel horrible, you're coughing, you can't breathe. That's the disease. You get the COVID-19 disease. And that's what can get you in the hospital and can ultimately, in its worst case, it can kill you. You can still get the disease, meaning that the virus can get into your nasal passages and it can replicate before the body has a chance to go in there and kill it off. There's that little window where it gets in there and it's starting to replicate. And at that point, that is when you could potentially, even though you've been vaccinated, you could spread it to someone else. And so until such time as we've hit critical mass and we have herd immunity, it's still possible for you to spread it to someone else. And so that's why we want to, we go back to this whole thing about, is masking for you or is it for the other person? And we went through that whole business early on in the pandemic, and it seemed to change a couple of times. But that truly is a situation where once you're vaccinated and you've had both doses and your body has become immune, you're wearing the mask to protect somebody else. And we're not talking about in houses and families. What we're talking about is when you go to the store, things like that.
Well, the other thing we know about vaccines is, unfortunately, no vaccine is 100%.
Bingo.
So the vaccine is about 95% effective in studies. But how my body reacts might not be that strong.
Mm-hmm.
I might not have a 95% chance to fight it off. Maybe I only have a 50% chance because, I don't know, we're human. Things are different. Yeah. My immune response might be different. So I could still get COVID. Chances are slim, but I could. As long as there's a high activity level of COVID disease, our chances are higher to get the disease, even when we've had the vaccine, and then we can spread it. And we just have to practice good pandemic behavior for a while.
Yeah, that's good.
Yeah.
So now you mentioned the 95% effective in studies, which is really, really impressive. On an average year, when we talk about influenza, what's a good year as far as a good vaccine? What are we talking about?
Like 68%.
Yeah.
And
that would be a really good year.
Yes.
So it's 40 to 60% in general, and so you have to. So if you think about that, 95% is really astonishing. So and again, the concept behind this with herd immunity is you get it so that the incidence of COVID in the community in general, or across the world for that matter, is so low that it's not gone, but the odds of you getting it is very low. That's kind of what we're working towards. So we'll get to a point where COVID's not going to go away. You'll get the occasional person that maybe doesn't respond to the vaccine and still gets it. But once we see that isolated case, someone comes into the ER and we say, this sounds like COVID, and we identify them as that, boom, we're able to treat them, contact trace, who are you around, and we stop it right there. The difficulty has been with the pandemic is you can't stop it right there in that group. You try and contact trace, but in the meantime, while you're doing that, it's begun to spoke out from there, and that's why it's been difficult. So eventually we'll get to a point where even though COVID's going to be around, it's not going to be as big of an issue. Flu is around every year. It doesn't go away. We all know this. So same kind of thing. But the question that comes up is, do you think we're going to have to get this vaccine every year?
Well, I wish I could answer that.
I know. We don't know the answer.
We don't know yet. Yeah.
Yeah.
Could be.
Let's see. When is the second dose scheduled for Door County? Second dose depends on the vaccine you get. If you get the Pfizer vaccine, it's 21 days later. If you get the Moderna vaccine, it's 28 days later. So in my case, I take care of COVID patients, and so I got my first vaccine on December 23rd, and I actually am getting my second dose next Thursday.
And the state program ships that second dose to us automatically. So when it's 3 weeks from this week, Door County Public Health will get enough doses to vaccinate the people we vaccinated in the last 2 days and give them all their second doses. We don't have to order that. They just are going to send it to us.
And I want to, let's see, I'm looking, we got a lot of questions. Ooh, 32. So I know I saw earlier someone had asked, and I think it's a good question, is, what if you aren't a patient of DCMC? Let's say you're a patient over at Bellin or at Aurora. You can still come here and get your vaccine. So we will have on our website, on dcmedical.org, we will have, when it comes time for other groups, we will have the ability to go on and register, fill out a form, and then someone will call you and set up an appointment. So that'll happen. And then public health will be doing similar situations as the time goes forward. So you won't have to be affiliated with us or anyone. You'll still be able to get the vaccine. Let's see. I'm sorry for the silence. Someone asked, what is 1B, 1C? I think, you want to just kind of, I think in a general sense, what are we talking about with 1B, 1C?
Well, they're priorities, population tiers. So the first tier was frontline healthcare workers and long-term care facility residents. The second tier is the next most tier most vulnerable, as deemed by the CDC, and as Dr. Heise said, the State Disaster Medical Advisory Committee for the state of Wisconsin determines the particulars for our state. And it kind of goes down from there and opens up to more people. We would love to vaccinate everybody today, but logistically that wouldn't work, especially because we couldn't get the vaccine, and geez, who would do that?
Oh, good. And Marie put the DCMC vaccine on the comments. And so it's 743-0539. So that's the info number. And I know people are asking, someone made the comment that we need this daily, not weekly. And we will. I mean, we'll this is one of those things where if there's something new to report, we want to report it. And someone else asked, what about the radio stations? I do a weekly radio thing on the Lodge and Door County Rewind. It's the same group of stations, so yeah, we're looking for any and all ways that we can, and obviously the media loves to get this information. So sitting behind the camera are two of our marketing pros, and they help get all this set up. So we were really committed to getting the information out, and I can't forget who's sitting to my right, because they also have a huge role to play in this, and they're going to be doing their own thing as well. And our information should be the same. I mean, other than, Sue's information may be different as far as public health may have a flu clinic at the EMS site by the fairgrounds. We're going to have it here. But as far as the tiers, who we're vaccinating, it's going to be the same. There's no difference. It's not a situation where CVS one day will have vaccines to give to people, and then public health will. We're all in the same, we're all constrained to follow those tiers.
And we're very aware that not everybody goes online.
Absolutely,
And
absolutely.
we are also at Public Health working on some radio blurbs, especially if the 70 plus are going to be in the next group.
Right.
They might not be as active online as others.
Let's see, I'm just seeing what else is being, where will high-risk people be, in what category? I think, again, I'm hoping by tomorrow we'll have information with 1B. So, 1B right now, the last we heard, just to kind of reiterate it, is people 70 years of age or older, police, teachers, education staff, and who else? Oh, and then like people in prison settings. Childcare, things like that. But again, that will be coming out specifically in the next, hopefully tomorrow, but in the next few days, and then we'll know specifically. And then I think after that, I would imagine what will be the large group after that will be younger folks that have issues, medical issues, comorbidities. So if you are, that gentleman had the question about a 45-year-old with Down syndrome. So maybe that might be 1 and 1C. It's hard to say. Again, it's all just supposition on our part, but my goal is to try and give you maybe an idea of when that might happen, because everyone wants to know, well, when might I be able to get the vaccine?
So the state did release, give permission earlier this week for us to begin vaccinating police and fire as of next Monday. And they didn't say that was 1B, they just said, moving on a little bit. So I kind of skipped over that, and I apologize, I didn't give that full explanation. So we have surveyed those people, and we ordered vaccine for that group for next week. The other thing is, we don't know always if we're going to get our full order of vaccine.
Right.
The state has to order vaccine from the federal government or agency in a similar manner, and if it's there, they'll get it. What they do if, say, they can't provide what we ordered, they will give us as much as they can, and they don't decide, okay, Door County Public Health isn't getting any, and Kewaunee County is. No, they split it in half and try to provide everybody with some vaccine.
A lot of people are asking specific questions about when will I be, what group will I be. I'm going to find my favorite question that I've seen so far, because it's a good question, but I got a kick out of how it was phrased. Kuros asks, what steps are we taking to gear up for the 100 million people vaccinated in the first 100 days after January 20th? And I get a kick out of that.
It could be.
Yeah, I mean, I don't think that we in Door County will have 100 million people. I kind of don't think so, and I know that's not what you're asking. But, I think, what steps are we taking? I think we're all working very diligently. As we said, how that works. I mean, how do you get 100 million vaccines out to the populace? You have to divide it into smaller chunks, and so there can't be, the federal government and the CDC looks at it from a broad perspective, and then they really count on the states to then further chunk it down to what categories, and then what are the municipalities, counties, what are they going to do? So we're a small chunk of that 100 million. So the hope is at least from my perspective, there's been the conversation about releasing as much vaccine as exists right now to get as many shots in arms as we can. And I think that's not a bad idea. I mean, the initial perspective was, let's make sure we hold back enough for the second vaccine dose. Again, not a bad idea at all. It makes sense to be safe, to make sure everyone can get their second dose, because that second dose is important. So we'll have to see how this all plays out. I know the President-elect's office has said he wants to basically get shots in arms and get them all out. And I think the Trump administration just recently said the same thing. So it sounds like the winds of change are moving in that direction to just get out as much vaccine as possible. We haven't at the hospital or local level heard specifics on that.
Right.
But we'll be ready when that comes.
Well, and as that you said that question, it's a little overwhelming.
It is.
Because how much vaccine can we get, and how fast can we get it, and then how fast can we get it out? And I'm picturing, okay, We could try to ramp up to 5-day-a-week vaccine clinics at public health. We are heavily dependent on our EMS partners
Yeah.
and our volunteers. We are a department of 10 people, plus our limited term employee contact tracers. So we will do our very best to get the vaccine out as fast as we can.
Yeah, and it
Yeah.
is, our team, it's been amazing when we go through our incident command, we do it twice a week, and we sort of talk about where are we with these things, and actually counting out how many vaccines can we give every 10 minutes, every
Right.
hour, things like that. So based on the numbers that we've calculated, if you take 8,000 people that are 70 years of age or older in the county, along with teachers and things like that, you take those 8,000 people, you're talking a couple of months to get those people vaccinated, running almost at full tilt. So it's not a quick process. It's a lot of people. And we're hoping too, once the broader categories are opened up, and I look at 70 plus as a pretty broad category. Once the broader categories are open, I'm anticipating that the retail pharmacies will get in on this too. I don't know that, but so.
According to the state, that's the plan. I don't know how fast the retail pharmacies can get on board and how many people they have capacity to
So
vaccinate.
We'll have to see. So a lot of unknowns at this point, and that's why, this is just one more way that we're trying to get the message out. I know it's funny. Last Sunday, Sue actually texted me and said, because as wonderful of a job as you do, this is not one of your favorite things.
You don't have to sugarcoat it.
No, this is not one of your favorite things to do. And so Sue texted me on Sunday evening and said, much as I hate to say it, I think we should do another one of these. And I'm all for it. I was thinking about that too. So I think that this is just one more way that we're trying to get the information out. And there's lots of people that are asking specific questions about, well, if I've had Lyme disease, am I on biologics? I'm a little nervous about answering those questions because I don't know that I know specifically. I don't know that I remember just off the top of my head, and I don't mind admitting that because, if I were talking to you in a conversation as a physician, I have resources to look up. But here, when I'm on the hot seat, in a live situation, I don't know that I want to say, oh yeah, it should be no problem. I know generally speaking, people have asked questions about what allergies should they be worried about. And I think the only allergies that you really need to worry about with this are if you've had an anaphylactic type reaction to injectable medicines.
Or vaccine.
A vaccine, sorry. So
medicines or a vaccine, injectable.
Yeah,
right.
So if it's injectable. So otherwise, from an allergy perspective, some people say, well, I get a bee sting and I get anaphylaxis. That's not a direct reason that you can't get the vaccine. One of the things that just pragmatically is I always tell people, hey, if you've got an EpiPen for anything, like if you eat nuts and you get an EpiPen, I'd bring your EpiPen along. I mean, we have epinephrine in our vaccine places, but what the heck, if you've got one, bring it along so you can give it to yourself if there's an issue. And thus far, there hasn't been.
So other times we would not want to vaccinate you is if you're in isolation or quarantine due to having or been a close contact of someone with COVID-19. If you've received antibody therapy or convalescent plasma for COVID-19 disease, it's recommended you don't get vaccinated for 90 days after that. And as Dr. Heise said, the severe allergic reaction, another contraindication is if you received another vaccine in the past 14 days.
That's a really good one.
And as I understand it, and jump in here, it's mainly because we want to know if the reaction, if you have one, is really from the COVID vaccine or could it have been from the other vaccine?
And we also, aside from that, that's one point. The other thing is we want an intact immune system because we really want the body to respond to that messenger RNA and create those proteins that are going to get the immune system going.
The other question we ask when you come through for the vaccine is, are you pregnant or breastfeeding? And that's not a contraindication.
No.
We would just like you to discuss it with your healthcare provider before you get the vaccine.
This is something we may put out on Facebook. And talking with my colleague, Dr. Dempster, who's an OBGYN, the American College of Gynecology has come out and basically said being pregnant or breastfeeding is not a direct contraindication to getting this, especially if you're pregnant. In fact, you probably do want to get the vaccine, because if you get COVID while you're pregnant, the chance of you not doing well is much higher. So, this is one of those things where you're better off getting the vaccine. But as Sue mentioned, I like to, in all these cases where people have specific questions, ask your individual physician. I would feel much more comfortable telling you to do that than just broadly tell you what I think you should do. I know one person here said that they have a specialist they see for Lyme disease, and that doctor said no. To be honest, I don't know if that's true or not, but I would listen to what that doctor has to say. Let's see. Do you want to comment on someone's asking about covering Washington Island?
That is something we have been talking at length about, and we are hoping that 1B covers a lot of people and that we can go to the island very soon and do a larger clinic. It's also been brought to my attention that the ferry workers are actually emergency transport people, because if you have an ambulance from Washington Island that needs to come down here, you need the ferry. So that prioritizes that group. There have been vaccines given on Washington Island, and Door County Medical Center was gracious enough to provide those to Tier 1A people up there.
Let's see, how long after a positive test can you get the vaccine? Once you're out of isolation, you're good to get the vaccine. Someone asked if you had COVID in the last 90 days, should you get the vaccine or wait until the 90 days after being infected? I think the answer is you can get the vaccine. There's no reason that you can't, but presumably we understand that within 90 days or so, and some are even saying 6 months, you have antibodies from having had the disease. So I guess the way I would choose to answer that is there's no reason you couldn't get the vaccine. Would you agree with that?
Yes,
Yeah,
exactly.
okay.
Sometimes it's been suggested that you wait the 90 days so that others can get that dose of vaccine.
Yeah. Okay. I'm just looking back up here. When do essential employees with letters from the government saying they can receive the vaccine now come in?
I don't know exactly what kind of profession that would be.
I have no idea.
But letters from anybody are not really criteria in the tiers. It is just if you fit into the description.
Yeah.
So in other words, I mean, I've had people submit letters to me that they were a Tier 1A worker, and from their job, yeah, they were, and I don't really need or want the letter.
Yeah, yeah, and I haven't heard that. I mean, that there's, so.
No,
yeah.
I don't know about that either.
How do we schedule to get the vaccine once we are qualified? Again, we will, if you go on to dcmedical.org, once we get into phase 1B, we will have a link that will put you through to entering your information, and then someone from DCMC, and this is just talking about DCMC right now, someone from DCMC will call you and set up an appointment time to have your vaccine. And I think and then public health, you can speak to how you're going to do those.
Right, watch for messaging, but we are looking at an online scheduler, hope to have it up and running in the next few days, and try that out, and because it's needed.
Yeah,
Yeah.
it is.
Yeah.
And this is a great question. Lisa asked the question, since I got the shot, my blood sugars have been higher. Must be a diabetic. Has anyone else been seeing that? It's very possible, and it's from my perspective completely understandable, because your body is ramping up. Again, it's creating an immune response. It's reacting to the intervention of this new foreign protein, and the body puts out cortisol as a compensatory reaction to that, and that causes your blood sugar to go up. So not at all surprised at that. So thank you for that question. Let's see. Oh, what's our take on the new COVID variant? Well, we know what I can tell you what I know, and then what I know to be true is that these couple of COVID variants, the big part, couple things. One is that the variation seems to make them more infectious, meaning that it's more easily transmissible than the garden variety COVID vaccine. It has not caused more severe disease. So that's not uncommon for viruses to find ways to continue to propagate itself. I know, as if you've watched these Facebook Lives and if you've heard me say on countless occasions, the only purpose the virus has in life is to replicate itself. That's all. It's all they do. And so they will find ways around things. The other good news is that from what we understand from I think both Pfizer and Moderna have come out and said that the vaccine is not rendered ineffective.
Right, it still works.
It still works. It still creates, again, it's that spike protein that it's going for, and so that's the good news. I did understand that there is I think the British variant is in Wisconsin now. The state has found that in their surveillance. Individual labs and individual hospitals, even in the cities, don't necessarily have the capability to check the genetic code of tests that they do. So it really is more of a state lab of hygiene type thing where they will look and they will do a random sample. Or if I were to have a case that just seemed really odd, that I had a high suspicion didn't behave like I'm normally used to seeing with COVID, we could send that specimen, we could call them and say, hey, I got one you may want to take a look at, and they would be able to sequence that and we could see. But it's not something that we regularly are able to say, oh yeah, you have this variant versus the regular one. As far as we're concerned, you either have COVID or you don't.
You explained that all very well, as
Oh,
usual. The only thing I would add from the public health point of view is we are more concerned with that variant because it does spread faster, and
Yeah.
in simple terms, it's going to cause more trouble.
Right, exactly.
But it's not shocking. You know, there's that virus
Yep.
change in flu virus, and
Yeah. If I were more clever, I could come up with an analogy about kids. I mean, it's just like if you leave out a bowl of M&Ms, your kids are absolutely probably going to try and find a way to sneak those and eat more of M&Ms. Same thing, viruses will find a way. You know, it's like the old Jurassic Park line, life finds a way. I mean, and it will. Viruses will find a way around things. Just looking for anything more. We're at 10 to 7, so we were actually over time. What's the youngest age you should get the vaccine? The vaccine is approved for 16 and above. So I think, so it has not been tested at all well, it is, they are testing it right now in younger kids, but it's not available for anyone younger than 16. And I think by the time it would get to the kids, that's way at the end, because their risk of contracting severe disease or after effects is much lower than those of us old people, right? And you're thinking, speak for yourself.
No, I wasn't thinking that at all.
All right. So again, I guess I think we're gonna start wrapping it up. I really appreciate all the questions and comments. I think that they're really helpful for your fellow citizens to be able to read the questions, and people are answering them, which is really great. Again, we're going to do our best, both from a public health perspective and from the hospital perspective, to get information out as many different ways as we can. So again, at least from our perspective, and I'll give Sue a chance for a plug in a second, from our perspective, go on dcmedical.org on the web, on the internet, and all the information will be there. I'm going to find that phone number again so that I can read it out loud. Here we go. 920-743-0539. That's the DCMC vaccine info line, and there'll be a recorded message at least every week. I know someone a minute ago had said, well, it should be daily, it shouldn't be every week. We'll make changes and adapt as we need to. So if there's something new to report, we absolutely are going to change. We're not going to let it sit for a week when there's new information. So that's a couple of the ways that we're going to put information out. Sue, from a public health perspective?
We do daily updates on our webpage, and we have a new COVID vaccine section that we have some frequently asked questions on, and we're updating that, and we also update our Facebook page. And thank you very much to the marketing team and to you for this opportunity to get more information out.
Always. And I think what we're going to do is I think it probably makes sense to, even right now, I'm dumping this on you right now, but I think maybe we'll plan on a week from today, let's do another Facebook Live, and we'll see what comes of the Phase 1B. And maybe it's something where we even need to look at doing it on Monday. So we literally take this and we go as the information comes. You know, when one of the things that I do is I look to see after the fact for these Facebook Lives, how many views was it? So how many people were on live, and then how many views total was it? I mean, kind of use that, at least I do, and along with the marketing folks, to determine, you know, is this something that's helpful to people? People wanting to see more information, but you know, we're more than willing to do it. So look for another Facebook Live next week, early week, middle week, we'll see, but that should be coming. So thank you once again for being a part of this. Really appreciate it. Thank you for the marketing team. Behind the camera is Mike Jarman, who is our new media. He's not new, but he's been thrown into doing videos. He's been editing together a lot of the videos that I do, and it's just been great to work with. And Erin Shortall, who's our Public Information Officer, she's behind the camera as well, and they just do an amazing job, and it's been a real pleasure and honor to work with them. And I haven't mentioned them before, so it's way past time. So thank you all very much for watching, and we'll talk again soon. Have a good night.